high needs children. This is a term that is used kind of out in the field by people like me who work with families with high needs children, and kind of around the realm of people who are doing things like providers who work with children of high needs. But I'm finding, as I'm kind of expanding more, that there are a lot of people who aren't familiar with the term. So there's a couple reasons I'm finding with that. And it may be that people don't know if their child has high needs or are unsure if their child has high needs. So I kind of want to clear that air. So for this sake, a child with high needs is a child that requires more time and energy from their parents. And I know the first reaction to that is all children require all their parents' time and energy, but these children are different. They require like a 24/7 high energy need from the parent or caregiver. And this is because they have high medical needs. They have an increased emotional need, physical needs, behavioral needs. They have constant need for supervision. They require more appointments like therapies, doctors, testing, things of that nature. They're not just a kid that you can let go play on their own. They have to be constantly supervised or constantly cared for. They can't just be a kid. They can't just go play and have fun. And in the same respect, some of these kids don't just play. And sometimes we can easily see these kids, and sometimes we can't. And I'll get into the red flags on that kind of stuff in a little bit. But some of these kids are diagnosed. Again, those kids that are easily seen tend to be diagnosed a little sooner or a little easier, but a lot of these kids are undiagnosed. And there's several reasons for that as well, but that can tend to be a preference thing. Some parents don't want a diagnosis. Some parents feel that a diagnosis causes a label, and they don't want that, and that's completely their preference. And I'm not here to push any preferences on anyone. I believe that having a diagnosis is very beneficial. There's a lot of options and services available when you have a diagnosis versus not having a diagnosis, limiting to no options. But we can have that discussion at another time. Some people don't have a diagnosis because they aren't aware that that's a possibility. They don't know why their kid acts the way they do, so they don't get to have that. They aren't being seen by the provider in the way that they are seen at home. You spend 24/7 with your kid, theoretically. I mean, maybe they go to school or whatnot, but your provider spends like 20 minutes with you, and they can't get a good assessment of what your child acts like on the day-to-day when you're in their office for 20 minutes. Okay, in reality, you're spending like 2 hours in there. I get it, I know. But seriously, like, they're laying eyes on your child, maybe, for like 20 minutes. And they're trying to tell you that your kid does or does not have something that you see going on 24/7. So, but to be high needs, you don't have to have a diagnosis. You can have an array of symptoms or signs that point to high needs without having that diagnosis. But with a diagnosis, the things that fall under that are the kind of given things like autism, ADHD, sleep issues, and they start very early. Infancy, that wouldn't be within like the first 6 weeks of life, but after that, those should start to balance out. That 6 week to 3 month period is is iffy, but after 3 months, those need to be monitored. But at any rate, sensory issues, feeding disorders, physical delays or disabilities, speech disabilities, learning disabilities, motor disabilities, cognitive delays, learning delays, I think I said that, mental health problems, memory issues. That's a short list, but it's kind of a general list that covers those things. So that's kind of in a nutshell what a high needs child is, and those are the things that explain like why those kids need so much more time and energy. And I'm going to say I don't ever use the word normal, because I first don't believe that normal is an actual thing. But I feel like that's an exclusive word, and I don't include that in the vocabulary. But some of the red flags that can show up, and this is a quite short list, and I do have a list here just to kind of help me guide, but I want to make sure I cover some of the big ones just for clarity's sake. I mentioned earlier poor sleep that starts early, poor eating or nutrition despite the parents' efforts. So I'm making sure to cover that those are children who don't eat, food refusal that's ongoing, not toddler pickiness. Pickiness is a word that I do a lot of teaching around, because pickiness is a common thing for toddlers that comes and goes. It's short-lived. It's a phase. And it doesn't last more than usually a few weeks, maybe a month or so, but it goes. And it usually bounces from food to food to food. Food refusal does not come and go, and it can increase in number of foods, but it doesn't change. So I do a lot of educating around the use of pickiness, but it is not actually a problem. Pickiness is a learned trait beyond that toddler phase. So when kids get older and have that pickiness, it's because they were taught to be picky and learned it. And adult pickiness is the same. Like, we are making a choice to not explore new foods. But at any rate, children with feeding disorders have a fear of food. Like I mentioned, my daughter would melt down when there was new foods on the table. So that's common. Gagging and vomiting during meals or attempting to eat is very common. The meltdowns. Meltdowns should be on my list like 6 times. Difficulty communicating, which could be a lack of communication ability completely, lack of sound formation during the infant years, and then no word development a little bit later. Difficulty with social interaction, social skills, avoiding eye contact. Eye contact is a tricky one, because sometimes it's there, sometimes it's not. And it is not a guarantee that it is a sign, but it is one of the signs. These children are unable or difficulty controlling and expressing their emotions. These kids have outbursts, both anger, sadness, generally, and they have a very difficult time controlling those. They may have abnormal gestures, they may not. And that's like the hand flapping, ticking, it might be their mouth, it might be their hands, things like that. These kids may not interact with other kids appropriately, and not outward acting toward them, but they may not interact. They may observe from far away, they may completely ignore the other kids. And this shouldn't be very common. Toe walking past the age of 2 is not typical. It can be a common thing that occurs in toddlerhood, but it should be short-lived, and it should be gone by age 2. Again, meltdowns, not tantrums. Those are two different things. Delayed milestones. Milestones can be something that people get a little antsy about. Milestones are pretty important. They are not for comparison. They are for knowing when red flags happen. So that's why we need them, and that's why they're important. We need to be aware of when things should have occurred and haven't. Like I said, the toe walking at age 2 is a developmental milestone problem. And when that's not addressed, it can lead to many, many more problems. So continuing, lack of attention, short attention span, hyperactivity, impulsiveness. Those are very common ADHD symptoms. A lot of people know those ones because that's been around, discussed for a couple decades now. But looking for response to emotion before they have the emotion. This looks like a child falls, does something that would prompt an injury, gets in trouble, something to that effect, and they look to you or to someone else to see if you're watching, and then they cry. As opposed to falling down crying and then seeing who's looking or who's coming for help, something like that. If they're looking at you first, that's a sign. Early health problems. Children who are sick a lot during infancy or early childhood tend to have more problems for high needs as they grow. A lot of these children will express or state things are too bright, things are too loud, things are too scratchy, itchy, tight. They have very sensitive sensory problems, and they may have all of these, they may have one of these. It's a varying list. They may be obsessive. They may have an item that they obsess over. They may have like a particular favorite topic that they obsess over. Restlessness, overstimulation, and overload are very common in these kids. And like I said, this is a short list because there's a lot of symptoms, and these symptoms in particular only cover a couple of the needs that I kind of discussed. Like there's a lot of symptoms that dive into each of these problems, and a lot of them overlap, and a lot of them correspond with another one, and it really takes a sharp eye to kind of make those connections, and a lot of our providers are not looking, and they're certainly not explaining this to parents. Again, no shade, I get it, and I probably should do an education on why providers aren't seeing these things, but regardless. One more thing about symptoms and things. Symptoms can present very differently in girls than they do in boys. Each child can present differently, so if the kid next door presents with A, B, and C, that does not mean your child will have A, B, and C. Your kid could have A, B, and D. Your kid could have C, D, and E. It's very different depending on each child. No child is exactly the same. Parents of high needs children. All too often, these parents feel alone, isolated, defeated. Having a high needs child is exhausting. Obviously, like, not only do I speak from experience from that, but like, it's very emotionally trying to have a child like this on multiple levels. You're trying to be the best parent you can be 24/7, and you really are doing like freaking fantastic. But at the same time, you are juggling this fact that everybody's looking down at you, right? Like, it doesn't seem like you can do anything that makes things right when all you're trying to do is what's best for your kid. and it's super hard. So you're struggling with all of those feelings and burnout and mom guilt, parent guilt. You're frustrated and you're sad and you're going to your pediatrician and they're not helping you, and you're trying to find out if you have a problem, why you have a problem, what the problem is, and like it just is like no one is helping you, and you're afraid for your child, and it's like no one is supporting you, no one is helping you, and you just don't know what to do, right? Like constantly on edge. I mean, not only because you have to constantly be like, hey, why is my child not safe? I need to keep them safe all the time, have to be watching, have on guard constantly. But now you're like, I just want somebody to help me, and no one's helping me. And there are many people who are facing this, whose families have pulled back, whose friends have disappeared. They find their communities are less than supportive. You're going to the grocery store and your child can't tolerate being in the shopping cart or walking through the store or spending any amount of time peopling, period. And everyone is watching you. Everyone is staring. Once in a while, there's like that one lady that'll make a comment and be like, it's okay, honey, I see you. It's fine. That's me. But everybody else is giving you the eye. Like, why can't you control that child? Because they have no concept of what you and your child are going through, right? Like, they're just watching. And like, it feels demeaning and defeating and awful. And yeah, like to the point where you quit taking your kid places and you quit going out and you quit doing anything because you don't know how they're going to behave and you don't know how they're going to act. And the people looking at you just feels so miserable. And there's a part of you that's like, I don't know why they're doing this. And then there's another part of you that's like, well, they can't help themselves. And then there's another part of you that's like, oh, if they would just stop so we can get through this stinking store. And then you feel bad because you're like so mixed and overstimulated and overwhelmed and miserable, right? Yeah. It's really hard. It's really hard. And all you want is to not be the only parent in the world who has to deal with this. You're not the only parent, I promise. 100%. So, parents with high needs children need support. And unfortunately, like I mentioned, a lot of their would-be support systems pull away. People don't know how to respond to children like this. They don't know how to interact with children like this. And rather than find out, they just disappear. And it's very unfortunate. That's why I am here to educate people about these things and provide this support, because it is absolutely absurd to me that this is even happening to parents. I don't understand why our support systems are doing this. I mean, I think a good portion of it is a generational issue. And at this point, like a lot of us are parenting differently, but we have to. Like, these kids are different, and we have to support their unique abilities. I like to call superpowers. But we have to support that. And parenting the way the generations before us parented just does not work. And it's not healthy. And we also have to work with what we're given, frankly. But this is why we need to be advocates for our children, not just within the healthcare system, but within our community, within our families, with the friends and the education system, because our children are going to need extra. They're going to need more support the whole way through. So I am here to provide that support and to show parents how to learn to be the advocate that their child needs. I am also very adamant that people learn about their children's issues properly. There's a lot of nonsense on the internet, and everything you read out there is not real. So I like to teach from an evidence-based practice standpoint. Everything I teach is based on science and fact, with some sass thrown in. But everything comes from research evidence. It's not unfounded. So I provide all of that when I am doing teaching. I also believe that as the parent, as challenging as it can seem, we have to be more involved in our own care. We have to be taking care of ourselves. And throwing out that term of self-care seems impossible, but we have to do more for ourselves to be in the state to take care of these children. And it's not just a matter of having a journal or going out for a walk or things like that. And those are all great, don't get me wrong. But having a high needs child is going to require more from us than just a couple minutes of quiet time once in a while. Like, we really have to get behind that. So we need to get more into those kinds of things. And then we have to be able to create boundaries with families, friends, and particularly those healthcare providers who are telling us our children are too young for a diagnosis or too young for an evaluation, or it's just a phase and this is normal, because we're throwing that word right out the dang window. I also want to support people and finding their specialists, because there are people out there who can help provide you with what you need when you need it. And it may or may not be very easy to find it, but it is possible. So I think that pretty much wraps up. I mean, I could go on and on for a long time, but this pretty much wraps up everything.